Chapter 1: The Denial Machine, the Engine of Profit. Most Americans would be surprised to learn that health insurance began as a nonprofit community service. In 1929, Baylor University Hospital administrator Justin Ford Kimball created a plan allowing teachers to prepay 50 cents monthly for hospital care. This simple idea, community members sharing risk, grew into Blue Cross, organized around the principle of community rating. The goal was stability, not profit. The system's fundamental transformation began when for-profit insurers entered the market with a different model: experience rating. Unlike community rating, which spread risk across entire populations, experience rating cherry-picked younger, healthier customers while avoiding those who might actually need care. This began the erosion of healthcare from a social good to a financial product. The pivotal shift occurred when the industry redefined its customers. Patients became the cost, while shareholders became the clients. The modern health insurance business runs on a simple equation: pay out less in care, keep more as profit. This logic has spawned a sophisticated denial machine that systematically delays and denies necessary medical services. The scale of systematic denial. The practice of denying claims is not a marginal issue, but a central feature of the business model. Data from 2024 reveals that the initial denial rate on claims increased by 2.4% to 11.81%. This continues a longer trend, with claims denials rising by 16% from 2018 to 2024. This indicates a systemic shift towards more restrictive coverage, creating a significant barrier between patients and their care. Deconstructing the denial playbook. The official reasons for denials often obscure the real-world impact on patients. The most common categories are notably vague or relate to procedural obstacles. Denial tactics and their impact. One of the most common tactics used by insurers is prior authorization, which requires doctors to obtain approval from the insurance company before providing care. This process can delay treatment and create administrative burdens. In 2023 alone, Medicare Advantage insurers issued nearly 50 million prior authorization determinations, illustrating the scale of this barrier. Another tactic is step therapy, often referred to as fail first. This policy forces patients to try one or more insurer-preferred, typically cheaper, medications before the insurer will cover the drug originally prescribed by their doctor. This approach can delay effective treatment and, in some cases, lead to worsening health outcomes. Finally, insurers frequently cite opaque or vague reasons for denying claims, often categorized under broad labels like other. These denials lack transparency and make it difficult for patients and providers to understand the rationale or successfully appeal the decision. The appeal paradox: proof of a flawed system. The most damning evidence that many denials are baseless comes from the data on appeals. Shockingly low. Appeal rate: despite millions of denials, patients and providers rarely challenge them. The appeal rate for general claims denials is below 1%. This indicates a system that relies on consumer and provider exhaustion. High overturn rate. When denials are appealed, they are very often reversed. In Medicare Advantage, a staggering 82% of appealed prior authorization denials are fully or partially overturned. This high success rate proves that the initial denials should never have occurred, creating dangerous delays for care that is ultimately deemed necessary. This bureaucratic gauntlet is not just an inconvenience, it is a primary profit center. Every delayed payment improves an insurer's cash flow, and every denied claim that isn't appealed is pure profit. The denial machine is the first and most direct mechanism of the hostile takeover, transferring risk from corporations to patients and systematically undermining the doctor-patient relationship. If what you just heard feels painfully familiar, you're not alone. Millions are fighting the same battles: denied care, buried in paperwork, worn down by design. Share this chapter, share your story, and bring one more person into the movement demanding a humane, single-payer system. Continue to the next chapter. We're just getting started.